Most people over 65 assume they've already mastered the basics of dental care. After all, if you've been brushing your teeth for decades, what else is there to learn? But here's the surprising truth. New research is shifting what dentists recommend for older adults. Not just how to brush, but how often, when, and with what. And if you're still brushing the same way you did in your 30s or 40s, you might be missing some key details that directly affect your health, comfort, and even longevity. Because for seniors, dental care is no longer just about preventing cavities. It's about protecting your heart, avoiding infections, maintaining nutrition, and preserving your ability to speak, smile, and eat without pain or embarrassment. In this video, we're diving into what dentists now say about how often seniors should brush their teeth and why this small daily habit could be one of the most powerful things you do for your health after 65. Let's begin with the standard recommendation you've probably heard all your life. Brush twice a day, morning and night. That's still a solid rule for most people. But as you get older, several changes happen in your mouth that require a bit more attention. Your gums may recede. Your mouth may produce less saliva. You may have crowns, implants, or dentures that require different cleaning techniques. And on top of that, your immune system slows down. That means a minor gum infection can quickly become a major issue if it's ignored. For many seniors, especially those with dry mouth or gum sensitivity, dentists are now recommending brushing not just twice, but 3 times a day, morning after lunch and before bed. Not harsh scrubbing, not aggressive toothpaste, but gentle, consistent care. Because plaque forms quickly, and in older adults, it hardens faster. That plaque doesn't just stay in your mouth, it can release bacteria into your bloodstream, which has been linked to heart disease, stroke, and even respiratory infections. And brushing 3 times a day isn't about perfection, it's about prevention. Small amounts of food, especially carbohydrates, left behind after meals feed the bacteria that lead to decay and inflammation. If you sip coffee with cream or snack on crackers between meals, your teeth are under attack for hours. A quick brush, or even just rinsing with water, can make a difference. But brushing, even for just 2 minutes, gently and thoroughly, can reset your mouth's balance and reduce the bacterial load significantly. Now let's talk about technique. Most people brush for 30 seconds and call it a day. But dentists now say that seniors should aim for 2 full minutes. Why? Because aging hands can lose strength and dexterity. You might not even realize that your brushing has become less effective over time. Using an electric toothbrush can help. It does the work for you and provides a more consistent clean, especially if arthritis or hand tremors make brushing difficult. Soft, bristled brushes are a must. Hard bristles can damage your enamel and irritate your gums. And toothpaste, look for one with fluoride, but without strong abrasives. If your gums are sensitive, or if you've noticed bleeding when brushing, don't ignore it. That's a sign of inflammation, possibly early-stage gum disease, and that's exactly what you want to catch before it gets worse. Another thing seniors often miss, brushing your tongue. Bacteria loves to hide there. If you're experiencing bad breath, dry mouth, or a metallic taste, cleaning your tongue gently with your brush or a tongue scraper can make a huge difference. It also improves your sense of taste, something many people don't even connect to oral hygiene. If you wear dentures, you're not off the hook. They need to be cleaned just as thoroughly as natural teeth. Plaque and bacteria build up on dentures too. And if you wear them overnight, you're increasing your risk of fungal infections and gum irritation. Dentists now strongly advise removing them at night, soaking them in a cleaning solution, and brushing your gums and tongue even if you have no natural teeth left. Why? Because your mouth still needs to be cleaned. Your gums, cheeks, and tongue collect bacteria and debris all day long. Let's not forget flossing. Many seniors skip it due to bleeding gums, tight teeth, or arthritis. But flossing, or using a water flosser, is non-negotiable. Food and bacteria trapped between teeth cause most cases of gum disease, and gum disease has been linked to memory loss and increased risk of Alzheimer's in several studies. That's not just about your smile, that's your brain. If this is all starting to make you rethink your habits, take a moment to comment oral health is total health below, because the truth is, your mouth isn't separate from the rest of your body. It's the front line, and how well you care for it impacts every system you rely on. Let's talk about timing. Many seniors brush first thing in the morning and right before bed, but dentists are now paying closer attention to when you brush, not just how often. For example, if you drink orange juice, coffee, or any acidic beverage in the morning, brushing immediately afterward can actually harm your enamel. Acid softens the surface of your teeth, and if you brush right away, you might be scrubbing away protective layers without realizing it. Instead, wait at least 30 minutes after eating or drinking anything acidic, or better yet, rinse your mouth with water first, then brush once your enamel has had time to re-harden. After lunch, brushing is especially important. If you wear partials, have bridges, or are prone to dry mouth, as we age, our natural saliva production decreases, and saliva is your mouth's natural defense against bacteria and acid. Without enough of it, food particles stick longer, plaque forms faster, and damage spreads deeper. That midday brush doesn't have to be dramatic. A quick, gentle clean can help neutralize acids and remove buildup before it becomes a problem. Now, what if brushing 3 times a day feels overwhelming? Don't panic. The goal is consistency, not perfection. Even rinsing with water after meals can help. Chewing sugar-free gum with xylitol can stimulate saliva and reduce acid, but brushing, even if it's just an extra minute or 2 after lunch, is one of the best habits you can form in your 60s, 70s, and beyond. And here's a myth worth busting. If you're not in pain, everything must be fine. That's one of the most dangerous assumptions older adults make. Dental issues don't always show up with pain. You might not feel the gum recession, the bone loss, or the tiny pockets of infection growing around your roots, but over time, those problems lead to tooth loss, costly procedures, and systemic health issues that impact far more than your mouth. Dentists now recommend seniors have a professional cleaning at least twice a year. But some need it more often, especially if you have diabetes, heart disease, or a history of gum problems. Your dentist isn't just checking your teeth, they're monitoring your health. In fact, many serious conditions are caught during routine dental visits. Oral cancer, autoimmune issues, even early signs of nutritional deficiencies can show up first in the mouth. If you wear full dentures, you should still see a dentist regularly. Your jawbone continues to shift over time, and poorly fitting dentures can cause irritation, infection, and even accelerate bone loss. Annual checkups help catch those changes early. Your oral health routine should also include checking for sores, lumps, or changes in color anywhere in the mouth. These small signs can mean big things, and catching them early is key. Let's zoom out for a moment. Why does all this matter so much after 65? Because what's happening in your mouth is directly connected to the rest of your body. Studies have linked gum disease to heart attacks, tooth loss to malnutrition, chronic oral infections to memory decline. When brushing becomes sloppy or infrequent or rushed, it doesn't just affect your smile, it affects your entire future. But the good news is, this is one of the few areas of your health where a tiny daily habit gives you massive control. 2 minutes, 2 to 3 times a day. That's all it takes. You don't need expensive tools. You don't need a perfect routine. You just need consistency and care. And if your hands make brushing harder, ask your dentist for help. There are grip aids, electric brushes with timers, floss picks, and water flossers designed specifically for seniors. You are not stuck. You just need a plan that fits your body now, not the one you had 30 years ago. And if you're caring for someone older, don't overlook this part of their routine. Oral hygiene often gets pushed aside in caregiving, but it's one of the most important indicators of dignity and comfort. Helping someone brush isn't just a task. It's protection, prevention, and peace of mind. So how often should seniors brush their teeth? Ideally, 3 times a day, realistically, as often as you can with full attention. The truth is, the number matters less than the quality. Slow down, focus, use the right tools, and above all, treat your mouth like the gateway to your entire body, because that's exactly what it is. If this changed the way you think about brushing, comment mouth-body connection below, because the habits we form now determine how we age later, not just in our teeth, but in our whole lives. And if you haven't already, subscribe and hit the bell, because here we talk about the details that matter, the overlooked truths, the small routines with big impact. This is where aging gets smarter, and it starts with you. See you in the next one.